Good morning. This is Andrew Stutman, the Acorns and CITE California Indian Tobacco Education Program Evaluator. I'm joined with Sohaib Arif. Would you like to introduce yourself?
Hi guys, this is Sohaib Arif. I hope everyone knows me by now. I run the tobacco programs at CRIB.
Fantastic. And thank you for joining us. We are going to go through a walkthrough of the CITE progress report. This report is very much like the main Acorns report for those who are familiar with that deliverable. So this should likely take a little less than an hour, but if you have any questions, please do interrupt. So without further ado, let us begin. I hope you can see on your end the shared screen. So when you do click the link that was sent in the email, the live link of the SurveyMonkey, you're going to see this page. So what we're looking at today is a preview link. So it is identical to the actual live link, but this is not going to record responses on my end, but your SurveyMonkey will look identical to this. So let us begin the introduction. So thank you for taking the time to complete this California Indian Tobacco Education Progress Report due April 20th, 2017. The responses will help guide the CRIB CITE team's assistance to your CITE program's chronic disease prevention and management strategies. So the CITE report focuses on strategies to prevent chronic commercial tobacco use and exposure, which have the potential to bring about sustainable policy systems and environmental changes. You're going to also see some instructions near the bottom of the pages. So click the next button below to move to the next page. And then you'll also see a progress bar as to the percentage of the survey that is completed. So we're already 13% completed, and we're on the first page. So
Congratulations.
Yes, not a very long report. So we will click the next button, and we are moving on. Next page, the instruction page. Here we are. For the following questions, please select responses that apply to your CITE program's chronic disease prevention and management strategies. Also in the spaces provided, please share additional thoughts or comments. If not applicable, please type not applicable. And then a little bit of logistics right here as to saving your work. So the survey will automatically save responses after you complete a given page and click the next button or the done button on the final page. You can edit your responses at any time, even after submitting the report, by using the link originally sent to your email and working from the same computer. And as always, if you need assistance or have questions, please contact me. I have provided my email address and my telephone number. You can always contact Sohaib, and if you can always then direct the questions to me as well. So we work as a team. So some more navigation instructions. The next button allows you to move to the next page forward, and the previous button to the prior page. So we are 25% complete. Let us continue. Just checking periodically. Wonderful. All right. Questions? No questions? Wonderful. Okay, so this is the first page where you have to fill responses, and as you can see, information regarding the agency and project contact. So these fillable fields are going to require responses. And in the event that you were to click the next button and not fill in a response in a required field, you will get a red dialog box that says the question requires an answer. So you wouldn't have to provide an answer for all of these fields. So the agency name, your organization's name, tribes represented, name of the health officer or tribal health director, the street, city, California, I'm hoping, zip code, and telephone number. Then we have the official project contact, so that individual's name, email, and work telephone number. And if the project lead is the same as the official project contact, then you still do need to fill in that information, and you could either put same as above or explicitly just describing who that individual is. So putting the name, email, work number. Perfect. And we filled in all the required fields in the agency and project contact information page. So let's click next, moving right along. All right, so this is the first page that's helping describe your strategy, your commercial tobacco strategy. So what we're going to see right here is a fairly comprehensive list of the different strategies that you can pursue as part of your CITE program. So this first question right here, this is the most lengthy page of the whole report, so we'll bear with us with completing this one page. First question, so please select one or more than one, if applicable, of the following choices that describes your CITE commercial tobacco use and exposure strategy. Please select all the following that apply. So as mentioned, you've seen a lengthy list of the different strategies, and please do select what most resembles or is applicable to the strategy that you're currently pursuing and or that you intend to pursue over the project year. So I just selected the first two, for instance, but you could have any number as you are pursuing or intending to pursue. And let's say there's something that isn't covered by these aforementioned listed examples of strategies. So you click the other, and I click that because it's going to require a response, but just we will see again the red lettering that's going to require you to fill it out. So let's skip that for the moment. The next box is please explain your CITE commercial tobacco use and exposure strategy. So more or less, we're asking here in this box for you to describe what this strategy entails. A little bit more description than, for instance, if it was commercial tobacco-free areas, putting a little more description as to what that means. So explain that right here. So description of strategies. Wonderful. And all of these questions, I didn't click the next button before selecting, but all the questions on this page, and as you can see, it's somewhat of a lengthy page. All the questions are required, but this is the main meaty portion of the page. So let's go back to where we were at. So explaining your strategy, we provided a description. The next question is, what is the setting of your commercial tobacco use and exposure strategy? So then again, please selecting all the following that apply. So the area that you're focusing on, so if it's a school, if it's the whole tribal community, if it's something else that's not covered. You also have the option to include a description of that other, it can possibly clinic, so we'll remember that as an example. So I'm going to leave that blank for the moment, but again, we'll see that it's going to be required if you so choose the other, because it does have please describe right there. So next is please describe the setting. So just a little bit more description as to the setting. So setting description. All right. Next question. Please describe the populations reached by your strategy. So describing who you're reaching, demographics, age, people who are clinic patients, people in the community, just being a little bit more description of the population description. Perfect. The next question is similar to the one before. So please share the number of individuals reached by your strategy from the start of the program, this CITE 2016-2017 program, through the due reporting date, so through April 20th. So we are looking for a specific number, though a range is acceptable if you don't have that exact amount, because it is true, it is sometimes difficult to ascertain, to assess, to count the number of actual people who have been reached. But just the same, however, people are being affected, influenced in some way to prevent or educate and prevent commercial tobacco use and its exposure. So number or range. And if you don't have, even if it's zero, please indicate zero. And a low number or a number of zero does not indicate any sort of failure at all. Please don't think that's failure. This is, as the ACO and CITE program, we are looking to create sustainable change, and change does take time. And we are very understanding of that. And we are collecting data, and data does inform us of the story in the process and the outcome and potential sustainability and success of these programs. And specific numbers are used in tandem with a narrative of basically as part of the story. So Please don't hesitate to include a number. There is no punishment for low numbers at all, but we kind of use the numerical number as well as the description. And please do, if you wanted to put a narrative here as to the number, a high or low number, that's for you to determine. Please do feel free to put a narrative in any of these boxes. Perfect. All right, so the next question. Please select the stage of the policy process that best describes the current status of your strategy. We do understand that not all strategies are codified in written policies. Nonetheless, these descriptions can still apply to the process of having some sort of policy systems, environmental, PSE implementation. So the problem definition, so the community, the community, tribal community team describing the problem, setting it on the agenda, or making action to include it henceforth, looking forward to address the issue. The policy formulation, so it could be actually drafting, making a decision and/or drafting the policy, or if there isn't a policy being enacted, creating a plan to move forward with the sort of implementation or intervention, policy or otherwise, and then the policy adoption. So again, it could be the adoption, moving forth, implementation of the policy, and/or implementation of the strategy, and regardless of whether it's written in policy or if it's just a change that's being made. And then implementation can go hand in hand with the adoption in the case that it's not being codified, but more or less just selecting what best relates to the stage where you're at when completing this report. So let's say that at this point you are in the formulation stage, for example. All right, the next question, the next box. Please explain the status or progress of your CITE commercial tobacco use and exposure strategy. So more or less describing where you're at in relation to the question before and in general. So description of status progress at the time of submitting a report and/or April 20th. If you're submitting it April 20th, if you're submitting it early of 20 years. Perfect. Next question. Please describe any factors that assist your CITE commercial tobacco use and exposure strategy success. I'm actually going to take a moment just to see if there's any questions. Perfect. I do see a question. So I'm actually going to, if I'm able to unmute, let's see. Eileen, would you like to ask the question? We could take a moment right now. You see, would we be selecting the topics that we identified in our CITE outcomes page in our application? Yes, you would be doing that. But if you actually are, if there's been changes since the application, then more or less, yes, most certainly you could make changes, or you could indicate further. You could indicate further strategies that you are pursuing that weren't included in the application. So, did you want to follow up with that, Eileen? No. All right. Well, perfect. I answered your question then. All right. Let's see. Just making sure. All right. Perfect. There we go. Sorry, I do not have I understand. Okay. Wonderful. Did you have any other follow-ups beyond? Basically, I was saying that yes, you can select. Yes, perfect. Thank you so much. All right. Any other questions at this moment, or give any other attendees an opportunity to ask a question? All right. Wonderful. Well, we're going to continue on, but I'm going to continue to look and see if there's any questions at this point in time. There it is. Okay, I see the questions are populated on the box. It makes it easier for me, easier for all of us. All right, wonderful. Moving forward. Okay. So we were at the assisting factors question. So describing any assisting factors. So anything that assists in the implementation, the success, assists in your project in any way. Please do describe that. Could be resources and partnerships, community support, tribal council support. Please do list that here. So assisting factors. Assisting factors. Next question that kind of goes hand in hand with assisting factors. Please describe any challenges and or barriers that affect your site commercial tobacco use and exposure strategy success. So please describe any challenges or barriers. Please don't hesitate. We do understand there each subcontractor, tribe, and tribal organization is unique and has unique circumstances. And basically providing that information to us allows the site Acorns, Crib Site Acorns team to be responsive to your needs in providing with the training and technical assistance, directing you to assistance, helping you overcome those barriers and address those challenges. So we're really looking to bring about as much success and effect as possible. So providing that information is very much useful. And of course, you can always call us, email us, and we attempt to be as responsive as possible. So letting us know so then we can help. All right. So as we see on this page, we've reached the last question. So please share any additional comments about your strategy. So this is the only question on the page. Even I said all the questions required. This one is not required. Any additional comments box. So if you have nothing to say, you can either put not applicable NA, or you can leave it blank. But if you have any other comments, please feel free to share those. So we've reached the end of the page, and we're going to click the next button and see if we filled everything out correctly, or fully, I should say. Correct answers, no correct answers. All right. And we forgot to enter a comment. Yes, we did. So with the first question, we did select the other category. So if there's a strategy that that you are pursuing, your tribal organization, subcontractor is pursuing that is not reflected by this list, please do describe it in the other. So a description of other strategy. Wonderful. And there was another one as well, the setting. So I just suggested the other setting that would be a clinic. Sometimes a clinic, the workplace can be a clinic, but that's not always the case. So clinic or other setting. Wonderful. And with that, I believe we've answered all the required questions. And as you can see, this one did not have a red lettering pop-up, so that was not required. So we're looking 50% complete, moving right along. Let us click the next button. Perfect. So community resources. Please describe the resources, for example, organizations and or individuals in your community that may help bring about the desired outcomes of your site program. For example, tribal leadership, school district representatives, nonprofit organizations, community members, AmeriCorps contractors. So much like on the former page where we're asking about assisting factors, community resources can be included in both pages. And this page is a bit more specific about resources. So, but before I continue, I did mention, I did attach, hopefully you did see, there's a handout I attached in this, with this webinar, as well as in the emails for the live SurveyMonkey webinar, and that is the site progress report questions PDF file. So more or less, that is, it's a PDF version of this report that you could fill. It has all the questions and such, and you can actually type in those comment boxes in the PDF. It's a type of a fillable PDF, and then copy and paste. So just more or less, so you have access to the questions, so you can complete it at your leisure, rather than being concerned with technical issues. Sometimes closing windows, if you accidentally exited out, and you don't want your progress to be lost. So having the resource of the questions in fillable boxes to be able to type those responses and copy and paste. So then you can see that community resources is going to be a question, even though on the former page we've already asked about assisting factors, which somewhat related. So more or less providing that that document, the PDF document, to assist. So please do utilize that, or whichever system best works for you in completing the report, but having the questions at hand, so then you could just have it completed a little bit more easily than on the go with the SurveyMonkey, which can be finicky. Wonderful. So in this box, this is a required box, and just to test to see if it's required, let's leave it blank and hit the next button. It is a required question. So then just describing community resources. Wonderful. All right, so we've described the community resources. And the next question, partnerships. So similar to community resources, they can overlap quite a bit. This one's specifically asking about partnerships. Please indicate your partners that assist your CITE program. Please select all the following that apply. So here's a list of potential partners that you may be working with to bring about desired and outcomes of your program. So please select all that apply. Perhaps CRIB might be part of that, but if there's another that is not included on the list, please describe that and specify. And then there's going to be this box right here. Please explain each of your partnerships, and that is also required. So providing a little bit of a description as to each of your partnerships. So describe partnerships. Perfect. So it seems though we filled out the page in its entirety. Let's click the next button. Oh, we did select the other button. So again, if you select other, then please describe other. Or a short description, and then a little, it could just be a list or list. Please list other, and then describe below. And we've completed this page, 75% complete. Okay, just checking if there's any hands. I do see a hand. Perfect. Yes. Eileen, did you have a question? I did see your hand was up. Give you a moment. Okay, not a problem. I understand. Your hand may have been up from before. All right, perfect. Let us continue forward. Perfect. And we're nearing completion. Wonderful. So now we are looking at the Memoranda of Understanding in Resolutions page. So another required page, almost to the end. Please describe any Memoranda of Understanding, MOU, and or resolutions your CITE program has established or utilized with partners for your commercial tobacco use and exposure strategies. For example, an MOU and or resolutions establishing parties' responsibilities, completion dates, joint use agreements, etc. So please describe MOU and or resolutions. And if you have no resolutions or MOU, please indicate that. We are looking to assess as much as possible sustainability, and building that sort of those relationships and potential infrastructure is suggested of sustainability, but understanding also in your communities and among your areas that sometimes there are strained relations, and it sometimes is difficult to establish those partnerships. But as much as possible, we are trying to encourage those partnerships, those collaborations, and we do have resources and trainings we can that we have provided and we can continue to provide to assist to facilitate the creation of coalitions and partnerships and collaborations, and then the eventual MOUs and or resolutions. So please indicate existing newly created MOUs and or resolutions and or interest and desire to pursue those and or barriers, and just so we can understand where you are at and being able to provide assistance with strengthening and budding existing relationships and such. Perfect. So let us move forward. 88%. Wow, we've gone to 100%. Came upon me as well. All right, so this is the last page of the report. So this is there's this additional comments box that is optional and not required to be filled, but you're going to see right here. Please click the done below right here to submit the response. If you don't click the done, then it won't be received as complete. Though on my end, I do see progress that's being made. But please do click the done button just to, I suppose, as a relief that you've completed the report. But then I'll be able to see that it's complete. And at the point of completion, I do check the SurveyMonkey regularly and then share the report with you. The SurveyMonkey does not share your responses after completing the report. I have to go in and provide that for you. It's just the way that SurveyMonkey is, the way it works. Wonderful. So at this point, yes, we have completed the. Well, I'm going to click the done button. There we go. We've completed the survey now. But I'm going to go back to the first page, just opening the floor for any questions at this point in time. So, all right. So, any questions thus far about completing the report? Again, it's a bit shorter than the full core Acorns report, which covers, it does include, the Acorns report does cover commercial tobacco use and exposure strategies, as well as healthy eating, local foods, physical activity, and community clinical linkages. So more or less that has another 3 large sections, but this one just on the CITE program and just on commercial tobacco use and exposure strategies. So any comments at this point in time? To see any hands raised. Anything so you'd like to add at this moment?
If there are any questions, we'll wait for a few minutes before we finally close. But I just wanted to give everyone a reminder that next week we'll have our electronic cigarettes webinar, and it'll be at the same time, and it'll be run about the same way, except maybe we might not have difficulties in the beginning.
Yes.
So look forward to that, and I look forward to seeing all you guys there, because it's pretty much the most important is for you guys. It's not for the rest of Acorn. We appreciate them too, but it's for the main core site people who are currently working on tobacco and tobacco education in their communities. So I look forward to seeing you guys. Any questions?
Wonderful. Questions at this point? Again, if there's any questions that arise after this webinar, please do get back to me or Sohaib, and we will respond to you promptly. Just checking any hands. Not seeing any hands. All right, we have a lively attendance. But you're going to see after I end the webinar, you're going to see a survey, a very, very brief survey. I know another survey. We're doing a webinar on a survey and asking you to take a survey of the survey webinar. But very, very brief, you can just provide some feedback. And we are also, since this is being recorded, we're going to share a recording of this webinar recording. I'll share that file for your further review and use. Even though this is a bit shorter than the full Acorns core progress report tutorial and the report itself, we do want to provide just the resource if there's any questions in completing it. But again, please feel free to reach out to us directly, and we will be able to answer any questions and or direct you to the appropriate individuals to facilitate the success and effect of your programs. So with that, one last check of any hands or questions. Looking perfect. Thank you so much, Eileen. We do appreciate the feedback. Wonderful. All right. Well, perfect. So I'm going to go ahead and stop the recording, and please feel free to stay on the line. So thank you so much. This is Andrew Stutman and Sohaib Arif signing off. So thank you so much for attending our walkthrough of this CITE progress report. Thank you so much. Have a great day.
Thank you, guys.
Thank you.